GLP-1 medications are usually the most effective treatment option that we can provide for type 2 diabetes and for obesity. Um, so there are a number of these medications, most of them for type 2 diabetes, some of them for just for weight loss or obesity. Um, as far as the diabetic medications, there is tirzepatide, which is Mounjaro. There is semaglutide, which is Ozempic. Both of these are once-a-week injections. There's the third one, Trulicity. And then there is Victoza, which is a once-a-day injection, Byetta, which is twice-a-day injection, not usually used much anymore, Bydureon, once-a-week injection version of Byetta. And then as far as Ozempic, again, it's a once-a-week injection. There's an oral form of it called Rybelsus, and then as far as the versions that are for weight loss, it's two of them. It's semaglutide, which is Wegovy, and that is an injection once a week, and now more recently a pill. Then there's the tirzepatide, which is called Zepbound. So out of all of these medicines, the semaglutide, which is either Ozempic for diabetes or Rybelsus, as the oral version for diabetes, or Wegovy, which can be an injection or a pill, as well as tirzepatide, which is just injectable Mounjaro for diabetes and injectable for weight, Zepbound. Those are the two most commonly used medications in this group. So how do they work? What do they do? So they look like hormones that our gut naturally produces when we eat. So when we eat something, these get released into the bloodstream. They help us with the digestive process. They slow down how quickly our gut moves food through the system. They help our body make insulin and receive the insulin signal, so we can deal with the sugar that our body's breaking the food down and that's being produced. And then they go to our brain and they tell us, okay, you've eaten something, you're full now. So they have all of those effects at the same time, and then our body just breaks them down with our own enzymes and they go away. So the medications, they look like these hormones. So all of the medicines have what's called GLP-1, or something that does the same thing as GLP-1. It just works a lot stronger. So it does all of those things, but to a greater degree. The tirzepatide, which is Mounjaro for diabetes, Zepbound for weight loss, it has two of these hormones, GLP and GIP, so it's a combination medicine. So the effects of these medicines are, in a good way, they help you feel less hungry, they help you feel full faster, and they help you to not think about food as much and not be consumed as much by hunger. And when we do eat, we have an easier time stopping. We can say no and push the plate away a lot easier. So they do those things. If they are too strong or we're sensitive to them, then the number one side effect is nausea. Then there's reflux, constipation, diarrhea. So we don't want any of those side effects. Some of them we're going to have to deal with a little bit, but if it's tolerable and we can do things to manage it, then then that's workable. A lot of times the particular medicine that we use is dictated by the insurance formulary. If we have every choice available to us, I usually prefer to use Mounjaro because I tend to see that it's better tolerated and and most effective. Especially the highest doses that are available are stronger than any of the other ones. But they're all very good, or they all can be very good. So I won't say that if you can't use Mounjaro because of your insurance, then I wouldn't use anything else. It's not like that. So they are usually one of the first things we think about when treating either type 2 diabetes or obesity. As far as, the negative parts or the concerns, again, number one is side effects. Usually if you're taking these medicines and you're not struggling with GI trouble, then you're gonna be fine. But if you're constantly sick, then that's when you can get into trouble with dehydration and maybe kidney failure because you're so dehydrated or your blood pressure is low. If you're taking other medicines that can cause low blood sugar, insulin or some pills that can drop your blood sugar, you have to be careful because you'll need less of those. So so you have to be working with people if that's the case to be sure you're getting through that just fine. But many times you can stop those other medicines. That's what makes this type of medicine so good. The black box warning risk for medullary thyroid cancer is there. That's a scary thing to see. But in reality, that doesn't apply to but to most people. Medullary thyroid cancer is very rare, and it's usually associated with a certain genetic problem. So if you were to have it, everybody in your family would be having these sorts of issues. So, I wouldn't let that stop most people. There is a blood test we can do that will tell us if you have medullary thyroid cancer. So sometimes that's nice to run that periodically when you're taking that medicine, just for assurance. But I've never seen or heard of anybody get medullary thyroid cancer taking this kind of medicine. So there's a lot to say about this kind of approach, but probably those are the most important things to consider. So one of the better treatment options for treating type 2 diabetes or obesity for sure.